Okay, so we are nearing the end of reproduction. So the baby has been developing and now we want to deliver it. So we're going to talk about some of the stages involved with delivering the baby, what's going on a few hours after birth, and also the process of lactation. So this is going to be real, kind of general information. Again, if you or your partner find yourself in this point in your life where you're delivering a baby, there's plenty of books out there with a lot of information, but for this particular course, we're just going to hit the highlights. Okay, it's a lot more complicated than what I'm going to talk about right now, but there's just so much time that we can spend on it. So at the end of pregnancy, those last couple of weeks, remember pregnancy is, about 40 weeks is a normal period for development in pregnancy and gestation. So during those last couple of weeks, the fetus is going to start to secrete cortisol. All right, and this cortisol will start to make the placenta secrete more estrogen. So it's a hormonal event. So the fetus is making cortisol, and that's making the placenta secrete estrogen. And what this causes is for the uterus to actually kind of upregulate and to produce more oxytocin receptors. Okay, I kind of went right through the word there, but more oxytocin receptors are going to start to show up on the surface of the uterus. And that's going to play an important role in the uterus contracting. Oxytocin is a hormone that when it binds to these receptors, it stimulates uterine contraction. So we're going to get more receptors present there so that it's going to be able to respond to oxytocin and then contract when the time comes. The fetus also makes something called surfactant, surfactant protein A from the fetal lungs. What surfactant is, we'll talk a little bit about it in the respiratory system as well. It's kind of a soapy-like consistency, and it actually lines the alveoli, which are the air sacs in the lungs, and prevents them from sticking together. So if you think about the inside of the lungs, it's almost like saran wrap. So imagine if you were to get saran wrap wet and how hard it is to pull that apart. Surfactant allows the lungs to open and close without sticking together. And premature infants a lot of times don't have surfactant. They haven't made that yet. And so when they take their breaths, their lungs are actually kind of sticking together. They really have to breathe hard to kind of open up those lungs. And so they'll have to give premature infants surfactant to kind of allow that to ease their breathing. But a full-term infant should be making surfactant, and that should be starting to accumulate so they'll be able to line their lungs with it so that when they can finally expel all that water that's filling their lungs in the amniotic fluid, then they can breathe air. That's basically what's going on. But the surfactant also does some other things, and one of the things it does is it allows the cervix to start to soften. So the cervix needs to start to soften and relax so that it can spread and stretch so that the birth canal can open up and so that the infant can then exit the uterus and be born. The fetus also has oxytocin, and it causes the placenta to produce something called prostaglandin. Okay, so oxytocin and prostaglandins are both powerful uterine muscle stimulants. Okay, so those both act to cause the uterus to contract forcefully. So you're kind of getting a double whammy of things that cause the uterus to contract here at the end of pregnancy. So two of these three of these things that we're going to talk about, the estrogen that's being made from the placenta, that causes more oxytocin receptors to be on the uterus. Okay. Oxytocin, which is going to be from two sources, the fetus and the mother's posterior pituitary. Remember, oxytocin is made in the hypothalamus and then transported to the posterior pituitary through those axons, and then it's released from the posterior pituitary. Oxytocin will then travel to the uterus, that's its target, and the placenta, and so it causes the uterus to contract, and it causes the placenta to make prostaglandins. Prostaglandins cause the uterus to contract. And every time the uterus contracts, it actually sends a signal back to the brain to make more. So every time the uterus contracts, more oxytocin will be released. More oxytocin goes to the uterus, causes the uterus to contract, causes the uterus, causes the placenta to make more prostaglandins. Prostaglandins makes the uterus contract, goes back to the brain, sends more oxytocin out. Oxytocin makes the uterus contract, makes the placenta make more prostaglandins, makes the uterus contract more. So that is positive feedback. So you're just, every time it's getting stronger and stronger and stronger. These contractions continually just continue to get stronger until finally the baby's born. So this is one of those few exceptions where we use positive feedback instead of negative feedback. So the first stage of labor is called the dilation stage. It's the longest stage. It can last 6 to 12 hours or more. It can last several days. Some people kind of get stuck here. And if they do get stuck, they give them something called Pitocin, which is basically a synthetic oxytocin. So you can kind of see what would happen if you gave a mother kind of an alternative oxytocin. That would kind of jumpstart the process, and you would get those contractions going. So if you don't get stuck, it lasts about 6 to 12 hours, and you start with some weak contractions. And as the oxytocin positive feedback cycle starts to increase, those contractions become more vigorous and rapid. So you may get contractions that are kind of weak, maybe every 30 minutes, and then every 20 minutes, and then every 10 minutes, and every 5 minutes, and now it's time to go to the hospital. All right. During this period, the cervix, what we call effaces and dilates, which means it kind of thins out and spreads apart. So it opens up this cervix, opens up the birth canal so that the head can exit. And so you can see that the fetus's head's kind of engaged in the cervix. And that's one of the things that kind of starts this whole process, kind of that pressure on the cervix starts this process of dilation and effacement. A lot of times the amniotic membrane will rupture and you'll lose your amniotic fluid. You've probably heard this as your water breaks. So that can happen at this time. It doesn't have to happen. A child can actually be born, with the amniotic fluid, the amniotic sac intact for a long, long time. Sometimes they'll have to go in and rupture that sac. And again, engagement occurs. So this is when the fetus's head will actually enter into the true pelvis and start more pressure on the cervix, and that kind of increases the positive feedback of the oxytocin. All right, so now we're just about to be born. So when the top of the head, the baby's typically going to rotate so that they're face down, and they're going to be born from the kind of the top of the head, kind of where the occipital lobe and or the occipital bone and parietal bone come together. That's what should kind of come out first. So you should see the top of their head come out first. And so once you see that, that's called crowning. So again, it's usually going to be somewhere around kind of the top of the head. Sometimes they'll come out with their forehead out, and they may have to do some manipulation if they don't easily come out. Sometimes they'll try to come out face first. But typically, as they're entering into that birth canal, the doctor's watching, and the nurses are watching, midwives are watching, or whoever is there to help you. And they can try to manipulate the head a little bit so that it comes out in the most efficient way possible, and it doesn't get stuck. If it starts to come out with the head in kind of an odd position, they can use forceps and open up the birth canal, or physically manipulate. And sometimes it just gets stuck and you have to have a C-section, which is where they just open up the abdominal cavity and take the baby that way. But let's assume everything's going fine. And so we get to the expulsion stage, and this is where you're going to expel or deliver the child. Really strong contractions. It just takes a couple of really strong contractions. They're going to be coming every couple of minutes. They can last up to a minute. And finally, you get one really nice, strong contraction, and out the baby comes. So the head comes out. They typically have to deliver the shoulders next, and sometimes they'll deliver the top shoulder and the bottom shoulder. They kind of have to wiggle the baby a little bit to get those shoulders out, and then the rest of the baby just kind of slips out. I don't have a good video. For some reason, our textbook doesn't have a really good video, but there are plenty of videos on the internet if you want to actually see an infant getting born. Now, after the baby's born, you're not done. You've got to get the rest of the stuff out. And so the placenta, and this is where you may have heard of this as the afterbirth. So again, it takes some more strong contractions. The placenta will detach from the uterus and everything will come out. These strong contractions will actually compress the blood vessels, and you're going to have some bleeding for a while, but there will be contraction around those blood vessels, compression of the blood vessels to stop the bleeding. After delivery, a lot of times they'll tell you to massage your belly, kind of massage the uterus, and that will cause it to contract even more. And the harder it contracts, the more compression it makes on the blood vessels and the less bleeding you have. So this can be a little painful after you delivered the baby, for them to rub on your belly and try to make your uterus contract to prevent further bleeding. All right, so the baby's born, and now it's been taken from this nice, warm, dark, floaty environment into a world of bright lights and air and people messing with it, and it's not real happy a lot of times. And so that's, they're going to be kind of irritable, and hopefully they're going to cry, and hopefully they're going to breathe, and all these good things are going to happen. And so one thing we say is the neonatal period, and the neonatal period is about 4 weeks immediately after birth. And this is where you really have to kind of watch and make sure everything is okay with the infant. So you have to kind of get through this 4-week period. But one of the things they do is in the first 5 minutes is they assess a lot of physical characteristics of the baby to make sure it's healthy. And we call that the APGAR. And I'm going to show you an APGAR chart here in just a minute. But this is if you've ever had a child, or you're with someone that's you're in the delivery room, and you notice the nurses and the doctors are kind of doing some things, and they're maybe writing down a number. They're taking the APGAR, and that's a really quick way to kind of assess how healthy the infant is right at birth. And then they'll do it again in about 5 minutes to make sure nothing's changed. Either the baby's gotten better or possibly gotten worse, or nothing. It's no change at all. So why does that baby breathe the very first time? Well, when it's exiting out of the mother and you've cut the umbilical cord, the placenta is no longer breathing for the baby, so now the lungs are going to have to start taking on that responsibility. And so before that first breath, CO2 levels start to increase. And so you get some acidosis, and that's actually the stimulus for that first breath. So a rising CO2 level is the stimulus for the first breath of the child. So a lot of times they'll try to kind of make that happen a little bit faster. They'll unplug the nose and maybe I don't think they spank them anymore. They used to you'll see them spank them on the bottom. I don't know if they actually do that anymore. They may just kind of jostle them a little bit, and they'll take that first breath. I've never seen them spank a baby, but they may still. So don't quote me on that. I've just never seen it myself. All right. So the APGAR, again, this was someone who kind of came up with a really quick way to assess how healthy a child was at delivery, and in about 5 minutes after delivery. And so the letters stand for characteristics that you're looking for. So A is for activity. So P is for pulse. G is for grimace. The other A is for appearance. And the R is for respiration. And so you give the baby either 0, 1, or 2 points, and then you add that up. So if the baby is born and there's no muscle tone, it's flaccid, there's no movement, okay, that would be a 0. If the arms and legs are flexed, they're not flaccid, so there's some flexion, that's a 1. If they're actively moving, that's a 2. If there's no pulse, that's a 0. If it's a low pulse, below 100, a 1. Above 100, it's a 2. Grimace, so kind of if you were to some kind of their reflexes, if those are flaccid, they're kind of weak, that's a 0. There's some flexion, kind of pulling their arm and they kind of pull back, that's a 1. Actively pulling back, active motion, sneezing, coughing, again, actively moving, that's a 2. What color are they? If they're blue, that's a 0. If they maybe have a pink body but blue extremities, that's a 1. If everything's pink, that's a 2. If they're not breathing, that's a 0. Kind of a slow, irregular breath is a 1. Vigorous cry, everything, they're breathing and hollering and screaming, that's a 2. So then they just put the numbers here, or they usually do it in their head. They're kind of doing this, that they're old hats at this. They can do it in their head. So if you've got a baby that is moving and they've got a nice pulse, they're got good reflexes, they're good color, and they're crying, then they're going to get a 10. So anywhere between 7 and 10, that's good. They're not too concerned. They're going to leave it in the room and not freak out. If it's 4 to 6, you know, we need to watch, see what's going on. Which one of these was the low score? What do we need to do to improve that score? And if it's 0 to 3, we have a real problem. Either the baby is stillborn or in severe distress. And so again, we've got to look at which one of these are depressed and see what we can do to overcome it. So if you have a low number and you do it again in 5 minutes and the number has gone up, then you're moving in the right direction, right? Things are getting better. If not, we've got to figure out what's going on. On the flip side, if you've got a good number and then 5 minutes later the number starts to go down, we've got to figure out what's happened. So this just is a really nice way to quickly assess the health of the baby and then see how it's progressing or not in a few minutes, and whether or not you need to take it to the ICU or not. All right, then you have what's called the transitional period, and this is last about 6 to 8 hours after birth. They're going to be kind of waking and sleeping. Their vital signs may be irregular. So usually they're going to be coming in every hour or so and checking on the baby's vital signs because they're not stable yet. And so they're just going to make sure that, you know, they're relatively stable and they're not crashing and things are going in the positive direction. But typically it will finally stabilize, and in a couple of days they're going to start to be on about a 3 to 4 hour sleep-wake cycle. All right, so keeping the baby in the hospital for 24 to 48 hours is a good idea, just to make sure that when they do leave the hospital, they're stable. All right, so let's assume everything's gone well, and so now you have to feed the baby. And so obviously we're mammals, which means we have mammary glands, which means we make milk. Obviously you can use formula, but if you want to breastfeed, that would be called lactation. And so when you're lactating toward the end of pregnancy, you're going to have placental estrogens, progesterones, and something called human placental lactogen. These are all going to stimulate the hypothalamus to make something called prolactin releasing factor. These PRFs are then going to act on the anterior pituitary to release prolactin, and prolactin will target the mammary glands for milk production. It takes about 2 or 3 days postpartum or after delivery for true milk production to begin. And this is another example of positive feedback. So in order for to lactate, you have to nurse or have suckling of the infant. So here is the child suckling on the mother, and there's mechanoreceptors in the nipple, okay? And that's going to send signals to the hypothalamus, all right? So you have signals going to the hypothalamus. The hypothalamus will release prolactin releasing factors. That's going to go to the anterior pituitary. The anterior pituitary prolactin will then be released, which will target the mammary glands, and the mammary glands will make more milk production, all right? Now, the milk's being produced, but in order for it to get out, that takes another hormone. That takes oxytocin. So again, when the baby is suckling on the mother, there's a signal to the hypothalamus to the posterior pituitary. Oxytocin is released, and there are some what are called myoepithelial cells or contractile cells in the breast tissue, which will allow for the milk to be let down and released out of the alveoli of the mammary glands and out to the lactiferous ducts and out through the nipple. And so you get milk let down and milk ejection. And so the longer the child suckles, the more oxytocin you get, and again, the more milk will be produced. And this is a positive feedback cycle. You don't have to have just these mechanoreceptors. After you've been lactating for a couple of weeks, there's kind of an emotional component as well. So if you hear a baby cry, it's going to start the process. So it's very common for a nursing mother to hear another child cry, and all of a sudden the milk lets down. So it doesn't have to just be suckling. It can also be, or just that If you've been feeding every 2 or 3 hours, and then that 2 or 3 hours comes and goes and the baby hasn't woken up, your milk will probably start to let down anyway because your brain's anticipating nursing to begin. So it doesn't necessarily have to have the mechanoreceptors being stimulated in order for milk to let down. All right, so before your milk comes in, the first couple of days, you're going to produce kind of this watery substance called colostrum. It doesn't have a lot of sugar in it. There's not a lot of lactose, but it's high in protein and vitamins, particularly A and minerals, and it doesn't have very much fat. So it's kind of a high protein, low sugar, low fat substance. But what it does have are antibodies, and it's real rich in something called IgA antibodies. And so this is kind of like a vaccine for the baby. So the mother is passing on immunity to the child because the child's immune system hasn't really turned on yet. So it can help protect the infant against bacterial infections. It can also, again, kind of jumpstart their immune system. And it's going to happen, about the first 2 or 3 days. And then your milk actually comes in. So what are the advantages to breastfeeding over formula feeding? Well, number one, the colostrum. If nothing else, try to breastfeed the first couple of days just to get that colostrum because it does do a lot of good for the baby. One thing that breastfeeding does is it's a natural laxative, and so it makes the baby's digestive system and large intestine start to move and get rid of something called meconium, which is kind of the first bowel movement of the baby. Once they get rid of that, that decreases their chance of having jaundice. So you want that to get going. Breastfeeding also actually puts bacteria into the baby's system. So it comes from the mother into the baby, so it helps to populate the gut, and we need good gut bacteria, and so that can help. The advantages to the mother is losing weight. You actually can eat a little bit more breastfeeding than you can, sometimes up to 600 calories a day breastfeeding compared to when you were pregnant. And so it helps you lose weight, so that's an advantage. The disadvantage is you're using some of your calcium. So you make sure you're taking a calcium supplement and you're not decreasing your bone mass. One thing I want you to realize is breastfeeding is not birth control. Okay, a lot of people, there's an old wives' tale, you can't get pregnant when you're nursing. You can. A lot of people don't get pregnant. It can act as a birth control, but it's not birth control because some women will ovulate when they're nursing, even though you have an inhibition of GnRH and gonadotropins while you're nursing. That's not 100% effective. So if you are nursing, do not count on that as your birth control. All right, and that's it. All right, thank you again. So just I think we should just be about done with reproduction. Thanks a lot.